Okay.
I'm also trying to ask people's age here, so if you can help me with that, that'd be great.
Sure, maybe let's wait a few more minutes till 7 p.m. Maybe we can do a poll.
Yeah, sure.
Okay. Mm, Huh. Okay, so I'm going to Nikki, can I ask, are you able to admit people or is that only me?
I think it's only me. You can give me co-host if possible.
Okay, how do I do? Uh-huh. Okay.
Yeah, I can admit people now.
Okay, so it's 7:01. Do we want to get started? Do we know how many people we're expecting today?
We still have more people joining right now.
Okay, so let's give them maybe a few more minutes.
Mm-hmm. Want to just wait till 7:05?
Okay, let's do that. Um, okay, so just as we're waiting here, let me introduce myself. My name is Sofiya Pidzyraylo. I am the program director at one of University Settlement's older adult programs called Village View Norc, which is an acronym for a naturally occurring retirement community. And I started out there as a social worker. So a lot of what I will be talking about today are things that, as a social worker, we've kind of encountered ways in which we've had to apply folks for home care and advise caregivers on how to do that. So we'll be going over some of that today. Um, If anyone wants to share, their experience with home care, is this something that you're interested in or somebody you're caring for is interested in? I would love to hear. Um, so there's a poll. We're trying to see if you can answer it, please. How many of the folks joining today are under 60 years old, or the person they're caring for is under 60 years old, or if you yourself or the person you're caring for is over 60 years old. So we can get a better idea of our audience. Okay. I'm gonna end poll now. And when, so 100% of the folks here today said that they are over 60 or they're caring for somebody over 60. So this is definitely going to be something that applies to you or your someone you're caregiving for. Um, I will do my best to try and answer any questions that come up in chat, or we can also go over them at the end. So I'm gonna start sharing my screen. Let me know if you can see it. Let's do that. Okay. Sorry, just one second. Um,
Get rid of that
oh,
one.
there it is. Okay. Can everyone see the presentation? Okay. Um, so as I mentioned, my name is Sophia. I am the social worker at Village View Newark. So we're going to talk a little bit about home care and the different ways that you can apply for home care. So what are some of the ways? Um, First, let's talk about what is home care, who qualifies for home care, the different ways to apply for home care, and some resources that might be helpful. And at the end, we'll answer some questions. So what is home care? Home care is care that allows people with special needs or older folks to be able to stay at home, um, or they might be recovering from an illness, from surgery, or they might have a disability. So some of the assistance they might need could be like dressing, grooming, bathing, feeding themselves, or making meals, right? Showering, using the toilet. Those are qualified as activities of daily living, right? It's kind of necessary things we need to do for life. And there's other classification called independent activities of daily living that we also need to do to take care of ourselves, such as housekeeping, shopping, doing laundry, traveling to appointments. That could be at the doctor or, just going grocery shopping or anywhere else. So home care services can include uh, personal care, as it is defined, personal care one, it involves with helping with activities such as housekeeping, cooking, and shopping. It's sometimes also referred to as housekeeping when you talk to folks in the home care community. These are tasks are also, like we mentioned, are instrumental activities of daily living. Personal care 2 includes all tasks previously mentioned, plus activities such as bathing, dressing, grooming, feeding, and these are the tasks called ADLs, activities of daily living. Home care can also include skilled nursing care. So if you have an acute medical condition or if you're recovering um, from a hospital stay, you might be referred to a skilled nursing care, right? So a registered nurse or other licensed healthcare professional will come to your home and provide maybe occupational therapy, physical therapy, wound care, and acute and chronic disease management. Um, so there's difference between personal care aide and a home health aide. So those are the people that might come to the home and take care of you or your loved one. The difference is a personal care aide helps with daily tasks like personal care, grooming, household chores, but does not administer medical care, right? So they will not provide medications, check blood pressure, or help ambulate. Usually they're not bound by strict federal guidelines, so they receive less rigorous training. A home health aide, however, provides more comprehensive care in addition to the personal care. They can handle basic healthcare tasks like measuring vital signs, assisting with medical equipment, administrative medications, and they go more comprehensive training program approved by the Department of Health to meet that qualification. Um, so ways to get home care. There's a few options, right? Private pay, um, that's paying out of your own pocket. Number 2 is the expanded in-home services for the elderly program. We refer to it shortly as EISEP. 3 is CHA, or short-term care, usually provided after a stay at the hospital. Um, and 4 is getting it through Medicaid, which is the government funded health insurance. And 5 is getting your own private long-term care insurance. So private pay home care. Private pay home care is pretty straightforward. It's home attendant or personal care services provided through a home care agency with your personal funds. So the benefit to this is that there's a lot of choice and flexibility to choose from. Um, the rates are generally in New York City that we've seen is from 36 to 39 per hour, and it could be more depending on needs. So you can visit New York State Health Profiles for a comprehensive list of agencies, or you can just do a quick Google search, ask friends who have received similar services, which agencies they prefer. There are so many in the tri-state area, so it's hard to say which one is better or not. It really depends on what you need. And the New York City. Also, if everyone doesn't mind to just mute themselves if you're not asking a question, which if you have a question, please do raise your hand. Okay, so this is the New York City Health Profiles website. So you can just type in, where you are in your New York, and what you're looking for, and they'll give you a comprehensive list of home care agencies available to you, and you can take a look at what they offer. Usually they won't list their prices and you'll have to call them and ask because they want to get you on the phone. But approximately the lowest rate I've seen is around 36 an hour. So EISEP Home Care. It's a program through New York State Office for the Aging, and it's also it's an abbreviation for Expanded In-Home Services for the Elderly. Uh, we'll get to Medicaid and Medicare, so I'll mention that in a little bit. So EISEP is a program specifically for older adults who need home care but who aren't eligible for Medicaid. So services can include case management, in-home assistance, other ancillary services, and home care. So EISEP does not have a fixed published income limit, but it does have cost sharing rules. So what they'll do is they'll interview you and ask about your income information, and then count what, based on their system, is how much you would be paying. So you might, for example, you might be paying from 0 to the $28.50, I think is the highest. This is not for long term. This is usually short term, and you cannot get 24-hour care from EISEP. So to be eligible, you have to be at least 60 years old. You need assistance with at least one activity of daily living or two instrumental activities of daily living. So if we remember, uh, activity of a daily living, or an ADL, is grooming, bathing, feeding yourself, showering. Instrumental activities of daily living are housekeeping, laundry, going to the store, um, so things like that. You have to be able to be safely at home and direct the home attendant. And you cannot be eligible for the service if you have Medicaid. However, if you have just Medicare, you are eligible for it. So each county has a different program that manages EISEP. So, for example, for the community district, I don't, if CB3 or something like that, it's Lower Manhattan. University Settlement is the one who is the case management provider for EISEP. But to find out who the program is in your area, you would call this phone number, or New York Connects. It's 1-800-342-9871, and then they will direct you to the correct agency to connect with. So that's a little bit about EISEP. CHA home care, or short-term home care. CHA stands for Certified Home Health Agency. And it's usually home care that is provided through Medicare, especially when you leave the hospital or you leave a rehab facility, maybe, meaning like a subacute rehabilitation care facility. A social worker there might arrange for short-term care. They'll provide a care plan that will include some kind of skilled nursing need. So to get child care through Medicare, that skilled nursing need has to be there. So you might need, wound care or some kind of, uh, injection that the nurse has to come. And with that, then you might be able to also get a home health aide. The patient must be homebound. What that means is basically they can still leave the home with the help of somebody or just going to the doctor, but for the most part during this time, they are staying in the home. Um, Although Medicare doesn't say that there is a limit to how long you can have CHA, they're pretty hard to get it for a long time because it has to be intermittent. So the Medicare will only pay for up to 35 hours a week for the home health aide care, though rarely more than 12 to 20 hours a week. So it's not a lot. With original Medicare, so you pay $0 for the covered home health care services, and Medicare pays every 60 days, which is called an episode of care. A lot of times after the 60 days, they will deny any further child care, but you could always appeal it. Medicare does not pay for 24-hour-a-day care at home. They don't cover meals delivered to your home, homemaker services like shopping, cleaning, and laundry. They might provide personal care like bathing, dressing, and using the bathroom, right? When this is accompanied with a skilled nursing need. So if you also need nursing services, then they will provide a home health aide for you. This is for original Medicare. But if you have Medicare Advantage plan, meaning a private plan that manages your Medicare benefits, it's different for every plan, and you really have to talk to your plan about what the home health care benefits you have. Any questions so far about that? Okay. Moving on from child care to the biggest one of all is Medicaid home care. So how to qualify for home care through Medicaid. So home care services are covered at 100% through Medicaid. It's the only long-term care insurance that will provide services for a long-term time. So the eligibility for home care through Medicaid depends on financial eligibility. You have to meet the income and asset guidelines. So you have to apply for Medicaid first. And then to be eligible for home care, you also have to have a medical need. So that is roughly you must need help physically maneuvering with more than 2 ADLs, or for persons with dementia or Alzheimer's diagnosis, need at least supervision with more than 1 ADL. A lot of complaints people have about Medicaid is that they won't just cover supervision, meaning if you have a person or loved one with dementia, they will not cover just, watching over them. So a note for those under 65 or not on Medicare, the following process is only for people with Medicare and who are over 65 years old. If you have Medicaid but not Medicare, then you generally do not need to enroll in a Medicaid long-term care plan. If you have Medicaid right now, you have Medicaid managed care and your plan already covers long-term care services, so you can contact Medicaid for more information. So what we're going to be talking about next is for people who qualify for both Medicaid and Medicare. So the application process for home care through Medicaid. First, you need to become eligible for Medicaid. 2, you will then schedule an assessment to determine need for home care. 3, you will receive a determination letter stating whether you're approved or not. 4, you'll choose a managed long-term care plan. That's the plan that will handle covering of those home care services. And then finally, you'll choose a home care agency to provide those services. Seems like a bit of a tedious process, and that's why there's a lot of agencies who help folks through it, and we'll talk about some of those agencies that can help. But we'll just go slowly through it, right? So how do we become eligible for Medicaid? So in 2025, to become eligible for Medicaid, your income for one person per month has to be under $1,732. For a couple, it's 2,351. Resources, that's an asset limit. For one person, it's capped under 31,175, and for a couple, it's capped under 42,312. Your home is not counted, your primary residence is not counted in these assets. So how do you apply for Medicaid? So you can apply through Access HRA, which is an online portal. It's probably the easiest one to do. You can also find your local Human Resources Administration office. Um, you can just look that up to see which one is closest near you in your area. You can also, in the end, we'll talk about some agencies, nonprofit organizations that help apply for Medicaid. And there's other ways to become eligible for Medicaid, even if you're over the income limit. So some of those is called Medicaid with a spend down. So it allows for you to deduct certain medical expenses, such as bills from doctor's visits, prescription drugs, or over-the-counter medications, or premiums from your income so that you can qualify for Medicaid. Um, the asset still has to be below the mentioned amounts. So for example, if I myself make $2,000 a month, I subtract that income limit that was for one person for Medicaid, that's 1,735. So about 265, if my math is correct, I will pay in to Medicaid to be eligible for it. Or I will show them that actually I spent 265 on different doctor's visits, prescription drugs, or premiums to qualify. Other ways to qualify is through a special needs pooled trust. So that same difference in amount you can put into a trust that is managed by a nonprofit. This doesn't mean that the money goes away. That money is actually still usable for paying rent, paying utilities, other bills, but you cannot use it for spending, for example, if you want to give a gift to someone or you want to travel, right? That money is only used for like necessities. Um, and then if you are over asset, you can create what's called a Medicaid asset trust so that it's an irrevocable trust, meaning once you create it, you cannot change it back, but you can change your beneficiaries so that that money is protected. The government will not take it away. So if you really need Medicaid to cover long-term services, you foresee that, you really might need help in the future. This is definitely something to consider for you or your family. Let me see. So as I mentioned, ADL in our first section, ADL is activities of daily living. Those are activities such as grooming, bathing, feeding, um, going to the toilet, showering, things that you really can't live without, right? So ADLs are assessed by Medicaid to see whether you qualified for home care. Okay. So, okay, here we are. So the medical necessity portion, right, that we just mentioned. So once you qualify for Medicaid, the next step is to see whether you qualify based on medical necessity. So in order to qualify for home care services, you must undergo an assessment that determines the type of assistance needed to perform activities of daily living, like I just mentioned, right? So this program is called NIA, or New York Independent Assessor Program, that the government basically created to make sure that it's unbiased in providing an assessment of the needs that uh, people need and need to be covered. All right, so once you have the assessment scheduled, during that assessment, a nurse will interview the applicant. They'll ask about performing those ADLs in the past 3 days and consider medical, environmental, and social factors. And those will be done over two different interviews. So some of the questions might be something like, were you able to shower by yourself in the past 3 days, right? If you say no, or I needed help with that, right? That means that you were not able to complete that ADL on your own and that you need help, right? So if you need help with at least two of those, right? So maybe it's showering and grooming, right? Then you will qualify for home care through Medicaid. So the NIA process, how do we set up this assessment? There is no online process. You have to call. You have to call NIA through this number, 855-222-8350 to set up an interview. You can do the interview over telehealth over your computer, but you can also request that they come to your home and do that. So they're open through Monday through Friday, 8:30 a.m. to 8, and Saturdays, 10 a.m. to 6 p.m. So anytime you can call them and schedule an appointment. So the first appointment, a nurse will ask a long list of questions to find out about your medical condition and what you need help with. They might ask a lot about, uh, you know, how you're dealing with your activities in the past 3 days. And then the second interview is a clinical appointment. So a doctor or nurse practitioner will ask a shorter list of questions to find out if the person has a stable medical condition and is self-directing. What that means by stable medical condition is it something acute, right, that needs help with right away, then this managed long-term care plan would not be appropriate, right? You would need skilled nursing care. So any medical condition needs to be managed and stable to qualify. So after all of this, you would get a determination letter telling you whether you qualify or not. Um, if we go back here, once you receive the determination letter, you can go ahead and choose a managed long-term care plan. There are a lot of good plans for you to choose from, and again, it's based on what you need, what you want. They all cover pretty much the same services. And then after that, you can choose a home care agency that you like to provide those services. Some people get denied on their first try through the assessment process. So if you receive an unfavorable determination, you can appeal with a fair hearing. Uh, the best uh, the best organization to contact is ICANN, or the Independent Consumer Advocacy Network. They're really helpful in advocating for folks to get home care or any issues that they experience. And if you have more questions about this process, they would be the perfect place to contact. So if you want to write down these numbers, we can also share these slides after. Um, the ICANN network is one of the organizations that is really helpful. So some other resources that might be helpful is the New York State Office for the Aging for any EISEP questions. So if you remember, EISEP is for those who have Medicare but do not qualify for Medicaid or do not have it, but still need home care and might have a low income. So EISEP is great for cost sharing options. To find out the EISEP agency in your area, you have to call New York Connects at 1-800-342-9871, and they'll direct you to the agency. Medicaid applications. So as I mentioned, you can do it on your own through Access HRA, or you can find a Medicaid office in your area. But if you need help, you can also do it through NILAG, which is the New York Legal Assistance Group. Um, they're really great. And you can call them at the number listed, 212-613-7310 on Mondays, or shoot them an email, and they can answer questions regarding any Medicaid issues. So I'm gonna stop sharing now. Okay, how do I stop sharing? Uh-huh, here we go. Okay. So I had some questions as we were talking. Does anyone have questions in particular about anything that we mentioned during the presentation? May I ask, like when when you think about home care, are you thinking about it for yourself? What is your situation? Do you think you might need it in the future? Are you somebody who has Medicare and, has had experience with home care, or you think maybe it might be needed? No questions. I'm surprised. Usually there's a lot of questions. Okay, so you're applying for Medicare this year, Kate, right? Um, so Medicare, so I'm guessing you're either you're turning 65 or you've had private health insurance and now you're going to apply for Medicare. Um, yes. So something you might expect is after, you have the cataract or hip surgery, right? The social worker at the hospital will tell you, okay, we're going to refer you to CHA care. That's one of the things we mentioned, right? That's with a certified home health agency for short-term care. Meanwhile, you're recovering, right? So you might get PT services for the hip surgery, right? Maybe you need home attendant help during the time that your eyes are recovering from the cataracts, right? Um, but it's a short-term period, and the thing is, it has to be intermittent, right? So if it was 24-hour care, Medicare would not cover it. But in the time that you need to recover, they will cover it. Usually, I want to say usually up to 60 days, but you can appeal that decision. It doesn't technically say anywhere that it's up to 60 days. The Medicare Rights Center is also another organization that's great in appealing decisions like that and advocating for more hours for folks. Yes, the Medicare Rights Center, I can include their information in the chat later on. Um, they are an organization that if you're experiencing any issue with Medicare, right, or Medicare not covering home care, that happens a lot, they will advocate for you to try and get more of those hours. I saw Christine, oh, sorry, Charlene, you had your hand raised. You want to unmute?
Thank you. I'm
Mm-hmm.
curious to know, this is wonderful. I really appreciate the overview. But I'm single, I live alone, I don't have any family nearby, and I want to figure out how to have a person who, so, and if I have a medical emergency, I'd like to be able to call like an advocate.
Mm-hmm.
Is that a case manager, and is that something I can set up ahead of time?
If you have an emergency. Yes. So usually there are case management agencies in your area, right? So depending on your community board, district, I think they're called, right? There's a different agency for each of those. So for example, if you lived on the Lower East Side in a particular neighborhood, University Settlement would be that that agency, and you'd be assigned a care manager, right? So, and they could help applying for home attendant services through EISEP or Meals on Wheels or something like you mentioned, right? If there's an emergency and you might need help, coordinating services after the hospital or something like that, then you would have a case manager that you can contact. Um, I will provide the slides in that, but for Charlene, you might want to contact New York Connects, and hold on. I will include New York Connect's phone number in the chat for you.
Okay, thank you.
And I'm going to share that with everyone and find out who the case management agency in your area is.
Okay, that's great. Thank you.
Yes. And then, Kate, you had a question about Medicare and applying for Medicare. Is that correct? Let's see. Oh, yes. Okay. So, you don't necessarily need, a organization to help you apply for Medicare, but I believe NILAG could help apply. And let me get you the Medicare Rights Center information. Here we are. Okay.
There's just so many. There's Medicare, there's all the advantage plans, all the parts,
Yes.
everything.
Yes.
And I need to know whether to apply for it in the first place because I'm currently covered by DC's 37 city employees, retiree,
Mm-hmm.
as a dependent.
So,
And I need to know which one is better. Like, should I stay with that or go to Medicare?
so at I believe at 65, you either way you get what's called Part A coverage,
Yeah.
and that is hospital coverage.
Mhm.
But Part B coverage, which is the doctors and any outpatient things, you can remain on your like you said your union plan, I believe you said, right?
Yeah, it's
You
through
can
my
remain
husband.
you can remain
And I
on
need
it.
a divorce. So,
Okay, so
yeah.
you can remain on it as long as you like. Just when you apply for Medicare, you will have to indicate that you're applying through a special enrollment period because they have a penalty if you
Right.
don't apply
It,
within
it's
the
coming right up. It's 3 months before or after
right,
you get paid.
right.
I've asked a lot of questions. So thank you so much for
That's
this.
Yeah, so the Medicare Rights Center, I included it in the office, but I think another one that is really helpful with Medicare questions, because this isn't necessarily a presentation on Medicare, but the high cap, have you heard of high cap? No. Let's see, high cap phone number. So this is a specific program through the New York State Office for the Aging, and it stands for Health Insurance Information, Counseling, and Assistance, and they will
Okay.
answer any of those questions that you just asked me. They will be very helpful.
Thank you so much.
Yeah. Any other questions? Maybe an anecdote on your experience with home care. I do want to say that in our experience as a social worker, sometimes you might get denied, or it might not happen right away, and that can be really discouraging. Which is why there's so many organizations like ours, like the ones that I've mentioned, legal groups that advocate for consumers, for patients to get the care that they need. And it's really great that they are nonprofits. You know, they work for the people to make sure that we're getting the care that we need. Okay, Iris, I see you have your.
Yeah,
Hi, Iris. Yeah.
I just want to say on a personal note that for anyone that's thinking about getting a trust, um, it's a long, complicated process. If you own your own home, it's not a problem. If you live in a co-op, the co-op may or may not let you even do it. Fortunately, I want to put my co-op shares in a trust for my daughter, and my co-op allows me to do it, but the process is endless and agonizing. So, it'll probably be worth it in the end, but it's quite an ordeal to go through.
Is it your primary residence?
Yes.
Hmm. Interesting. Well, this is why for any assets, we always there won't be any pro bono attorneys usually that will do it. You have to get an elder law attorney
Which I have.
who qualifies and knows what they're doing.
Yeah, it's
Um,
an expensive process.
and it could be worth it in the end, right? Because Medicaid will cover those long-term care services for as long as you need, right? Which not even the other option that we didn't talk about today is long-term care insurance. And sometimes that's really expensive, and though it says long-term care insurance, it might not cover half the things that they say they do. So, you know, those are things you can explore on your own. But yeah, Medicaid is one of probably the only one that covers it at 100%. And good luck to you. I hope it all turns out well.
It seems to be wending its way through.
Oh, Marjorie. Okay, can we unmute you? Marjorie, did you have a question? I see you raise your hand. I'm asking you to unmute, so just click that button to unmute yourself. Hmm. Okay.
Patty Frascatori.
Oh, hi, Patty.
You asked for experiences before the pandemic. I had intermittently gone very intermittently to the extreme, just to eat the vegetables to a senior center. And I had a social worker started calling me right before the pandemic, the shutdown, and pestering me about getting food, Meals on Wheels.
Ah.
And I finally said yes. And it was on
Mhm.
a Friday, and on the following Tuesday was the shutdown. And on Monday, the food started. So that
Mhm.
was incredible.
Wow.
Yes, that was truly incredible. But now I was a youngster. I was still in my 70s. Now I'm in my 80s. And I was ill recently, and I could see how quickly I was walking 3.5 miles a day effortlessly. But when I was ill, it was about 2 weeks ago, I stopped. I couldn't walk. I figured I didn't want to eat, so I didn't eat. And I could see that things are changing rapidly.
Mm.
And so this is very vital. And I think I need to find out more about the trust and the 5 years or whatever it takes.
Yeah. So I did, yes. So now for the managed long-term care, if with the assets they have a 30-month look back period, it actually starting in March, right? So if you're going into a nursing home, that's 60 months, so that's 5 years. If it's in the community for New York State, So if you're just getting home attendant services at home, it's 30 months. So 2 years.
2 years.
Actually.
Oh, okay.
Yeah.
Thank-
Yeah.
yeah.
I would go back to that social worker. Maybe.
It's changed.
Oh,
it has
I see.
it's I'm out of the district now, and it was, I think somehow I connected like with the head social worker. It's the largest. It has a 5,000 people in Brooklyn area, and then
Uh-huh.
one senior center. And I see my old social worker almost once a week because I have therapy and
Okay.
there. And
So
I could ask her maybe some questions.
So, there are other options. I think I don't know a lot about Brooklyn, but there are options. For example, if you just need short-term, um, you know, care and you want to pay out of pocket, there's something called like respite care, right? It's somewhat discounted. It's still like it could be from $9 to $20 an hour, but if you need some help just during that short-term time. And I would recommend contact New York Connects to see who your case management agency is so you can get your Meals on Wheels. Just in case, you might not even need them right now, but they'll have your case. So when you need it again, you can just call them up and be like, hey, remember me? I really need it now. So I'd
Okay,
recommend you do that. Yeah.
okay. Thank you. Thank you. So it's only 2 years. I think I have 2 years left in me.
Really hope so.
Pounding,
Well,
pounding the pavement.
Well, it's right. It's the thing is I'm not an expert. There are, if you're just transferring money, then yes, there's definitely a look back. But there are legitimate ways you can spend it that, would not ring
Oh
bells. But
no,
I'm not the one to ask about
I
that.
don't
Yeah,
have a good income, but I'm asset rich. This
I
house is
see.
worth a lot of
hmm
money. Yeah,
hmm
I have very.
So I will say, gosh, I should have included that. If your primary residence is under 1 million and something, it's not counted towards your assets, which is why it, you might not need you need the asset trust. But that's only if this is your primary residence and if it's under a certain amount.
Yeah, the issue is if you need nursing home care, then
Mhm.
it becomes a problem. Then you want to protect your residents.
Which is, yes, right, right. Which is why I'm not the expert on that. And those resources that I provided, those agencies are really great. And you can.
Marjorie's back.
Hi, Marjorie. You had a question.
Yes, I not only unmuted, but I disappeared myself completely, of
Oh, God.
course. Um, you may have talked about this while I was gone, but I've carried long-term care insurance for a long time, and it's ridiculously expensive. And I
Mhm.
just got a letter saying that they were going to increase it. And I mean, I don't know. I I don't know exactly what to do because I don't want to discontinue it after I spent all that money on it. I mean, do you have any
Mhm.
advice about this? It's just getting ridiculous.
With long-term care insurance, I don't because you have to probably call them and actually find out um what happens if, for example, you need long-term care immediately. How much will they provide? How much will they cover? Because sometimes they say
Yeah,
they will cover it at but they might cover it only at 50%, right? So
yeah,
there's different benefits. You have to talk to them and see whether it's worth it for you. Um,
yeah, to keep it. Thanks.
yeah, yeah. Um, can cancer survivors hope to get long-term care, or do they just not? Um, So, if you're a cancer survivor and you're experiencing, that you need help with those activities of daily living, then yes, you can get long-term care. But if you do not, right, then unfortunately that's not taken into consideration as one of the medical necessities for long-term care. Unfortunately.
Thank you. I guess I mean, like, will they even sell it to me? I mean, I know that
Oh, like the
I have a they're gonna I'm a breast cancer survivor, like 20 years out, but they I know how they are. And you know, also concerns about, you know, the current administration is, you know, actually interested in raising rates, I think. Not to be too scary, but yeah, I wondered, like, if I'm just out of the ballpark entirely for private long-term care insurance.
I'm not sure.
You might not sure.
With private insurance, I'm sure there are some, but you know, you have to call and ask, and it's a tedious process, I'm sure.
Oh yeah. Okay.
But
From the people that I've spoken to who have tried to get long-term, recently it's almost the policies are so meager compared to the premiums that unless you got one 30 years ago, it doesn't seem like a really great fit these days, unfortunately.
Oh well. Thank you.
okay. Any final thoughts? Any final questions? Nikki, are you still there?
Yes, I'm still here.
Okay. So unless there's anything else, Nikki, you'll share the slides from today.
Yes, no problem.
Okay.
I'll share with Nova, and for those who I have email addresses, I'll just share with you directly. For those who did not share their email addresses with us, please reach out to Nova, or Nova will share it to you, okay? Thank you so much.
Okay, thank you so much for your time. I appreciate you listening to the presentation. I hope it was helpful, and it was very nice meeting you all. And I
Thank you
hope you have,
so much.
Thank you.
okay,
Very
Thank you.
helpful. Thank you.
have a lovely evening. Bye-bye.
Have a
Bye-bye.
lovely evening. Be well, everybody.
Thank you.
Yes.
Bye.